Nasal trauma is defined as any injury to the nose or related structure that may result in aesthetic deformity and decreased nasal breathing due to obstruction of the nasal valve area. The nasal fractures are a common occurrence in accidents and in emergency are often dealt inadequately or by inexperienced physicians, leading in some cases to complex revision surgery, whereas simple correct manipulation at beginning may have sufficed. Restoration of pre-traumatic form and function today remains a challenge. Commonly, the product of a poorly addressed underlying structural injury is post-traumatic nasal deformity that requires subsequent rhinoplasty or septorhinoplasty. This may account up to 50% of cases. These post-traumatic revision cases are very difficult to handle cosmetically and functionally. Internal nasal valve collapse accounts for the nasal breathing impairment in these cases. It can be divided depending on the structure that caused the collapse. In many cases, more than one structure is affected. The most common cause is probably septal deviation. The second cause is collapse secondary to trauma of the nasal roof. Obstructive scarring is also common. Correction of the deformed nasal skeleton and resection of the synechia or scars must be performed because some synechia and scars are quite thick. Good results have been obtained by separating both sides of the nasal valve with long-term silicone sheets. After functional and cosmetic correction, recurrence of the corrected nasal deformity is very common in these cases because of cartilage memory and scar contracture. To prevent recurrence and maintain the correction, a permanent support is needed, the so-called structural grafts employed to reinforce or replace the traumatized structures. A different approach may also be employed to achieve a visual effect of symmetry and projection of various nasal areas by filling depressed soft tissues, areas with or without correcting the underlying nasal framework. This is the so-called camouflage grafting. Concluding, the nasal skeleton and the skin and soft tissue are normally in equilibrium, but trauma disrupts this equilibrium, leading to septal deflection, middle vault collapse, or alar buckling. It is felt that correction of deflection or depression by trauma needs to be improved with augmentation, which provides balance for the previously disequilibrated skeleton and soft tissue forces. In our experience, bony cartilaginous septum realignment seems a key point for morphofunctional restoration. The use of graft is felt to improve morphofunctional results, counteracting soft tissue contraction and deformities. Thank you.